Welcome back and thanks for joining us. Here we are, Uncle Bob, right here in front of Andalusia Health, formerly known as Andalusia Hospital. It's a business that has been in business for over 50 years. In a half a century, they've learned a lot of things. And that one thing in particular they've learned is that wellness counts. And so they're really concerned about, honestly are concerned about your health. The Andalusia Health team is fully committed to treating our patients with genuine care and delivering exceptional clinical quality and service to our community. One thing that I want to stress in this introduction is we'll be going inside to all the new departments inside of Andalusia Hospital. We'll be going to the surgical unit where they do have brand new equipment. We'll be going to the imaging department where they have brand new equipment for CT scans and nuclear stress tests and nuclear scans, cardiac scans. They have a complete brand new state-of-the-art place where you can, if you need dialysis, where you can do inpatient dialysis service. You don't have to go out of town anymore. Another thing economically that's so important about Andalusia Health is they have routinely 285 employees with a $14 million plus payroll. And they've contributed thousands of dollars in community service. And they are part of the community. There's no need to go out of town to shop for doctors or a hospital anymore. You can get virtually anything that needs to be done can be done here. You can drive up and you can go to their walk-in clinic. You can go to the emergency room, and if you need other care, they'll wheel you right to that room where the care is needed. You don't have to check in at the main office when you get imaging done. When you drive into the hospital, on the left-hand side, there's the imaging department. You can go there. You can pre-register. Your family physician, your healthcare physician, can pre-register you for a multitude of outpatient surgery procedures. They've got a brand new, remodeled outpatient surgery wing. It used to be the in-house therapy ward, but now there's 12 suites back there, huge rooms, that when you come in for a procedure, you check in, get the procedure done, and they wheel you right out the back door. Nobody even sees you. It's amazing. And they have new extended hours in the imaging department for mammograms. And October is Breast Cancer Awareness Month. So you want to, don't let anything stop you from getting the health care that you need. Make sure that you, between now and then, that you make an appointment and have a breast exam and have a mammogram here done at the imaging department. They're open on Saturday even, for goodness sakes, every other Saturday. So there's no excuse anymore. And all the procedures here are done with friendly staffs that really love working here. The doctors love it here. They've done an excellent job of recruiting new doctors. John Yang is the new CEO. He's been instrumental with Life Point Hospital in making Andalusia Health the premier health care facility in South Alabama. So when you think of health, think of Andalusia Health, where love replaces fear. Welcome back and thanks for joining us. We're right here in Andalusia Health, formerly Andalusia Regional Hospital. Been in business half a century, and they do so much for our community we can't even begin to tell. But I'm here with Laura at the CT scan in the imaging department, the brand new state-of-the-art imaging department where they've put a lot of capital improvement. Miss Laura, this is a brand new General Electric CT scanner.
Yes.
What does it do?
Man, it'll do a lot. Basically, we use this machine for a lot of diagnostic purposes. We are able to take a cancerous or a tumor that may lie within the body. We use this machine to do some locating, get very precise locations and measurements. The radiologist is able to come in and introduce a small, very fine needle into that area and aspirate some of that tissue out so we can send it off for analysis and testing. We are able to do vascular work, reconstructing with this machine, does absolutely beautiful orthopedic work. We've got some new programs going on with one of our orthopedics that they use this machine to take measurements of certain areas like the knee. Then they send that information off. They build the prosthesis for that knee that's like a hand in a glove. Yeah, a lot less invasive. It kind of aids with those type of things.
Well, I'm telling the age, But I can honestly recall when the only CT scanner in Alabama was at University Hospital in Birmingham. And to have one in Covenant County is, you don't have to travel out of town to get complete, accurate, expert diagnosis.
Right.
Because you can put it to the, on the dot.
On the dot.
On the
yes,
dot.
Sir.
And that's something that when you're talking about critical body functions, it is important.
Very important. Very important.
And the Andalusia Health has spent a lot of money recruiting new doctors, and we've got a wonderful, brand new, just like the orthopedic, Dr. Kelly
Correct.
and Dr. Price, and they need this kind of measurement in order to do their job properly.
Absolutely, absolutely. It's very essential to, even with our oncology center, like I was saying, the location of a very small, minute lesion, the precision that we have with this machine. It is a 64/GE Optima, and we are very fortunate and very blessed to be able to have it to aid with whatever they may need, to get complete care for their patients, whether it be a stroke alert, and getting very rapid imaging of a patient's brain to assure that they don't have an active bleed or having a stroke, getting results quickly. It is an honor and a blessing to have it.
What about referrals? Do you have to have a referral from a doctor, or can you come to the walk-in clinic and they say, you might need a CT scan?
Any licensed physician or nurse practitioner can write for a CT scan. Yes, sir. It's doesn't necessarily have to be on. You can't just walk in and have one.
No, of course
but
not.
yes, you do have to have a referral to come to have one.
And the wonderful thing about that is now you can pre-register online. I think that's one of the greatest things that's ever been invented. But let me ask you this: is there a huge long waiting line for the service?
We have actually, since we've gotten this machine, of course our workload has increased, but scanning time has greatly, significantly reduced. So we are able to bring patients in, scan them, and have them out of here in a much more sufficient time. Wait times are generally very minimal, unless we are just really, really having a busy day, but generally we would say about 15 minutes.
I think it's important for our listeners to know we have people from all over the county watching this, and that the hospital, if you drive into the hospital, and on the hospital property, on the left is the imaging department.
Correct.
And you don't have to go to check in at the main hospital anymore.
Right.
You can come to the imaging department, so much more convenient, truly convenient.
It is.
And there's a whole variety of services they offer in imaging. Of course, this is probably, in my opinion, the most sophisticated. I don't know, I'm not a doctor, but it seems like this is a pretty nice piece of equipment.
It's really a nice piece to have. And yes, we did bring registration, complete services to this end of the hospital to reduce the patient's walk. Some of our elderly patients were having to walk quite a distance to come from the front of the hospital down to the outpatient imaging service end. So we've reduced that walk, that time. Everything is trying to make it a lot more efficient.
Well, they really get you in and out. I've been able to use the service, but also, don't you send the image to the orthopedic surgeon instead of him having to come up here and all that, mail and all that? And it's almost instant, isn't it?
Everything is fairly instant.
It's unbelievable.
Yes,
It's quick.
everything's digitized and digital, and we transmit all of our images through our PACS system. Yes.
Well, let me ask you this: as an employee of Andalusia Health, you enjoy working here?
I do. It is a great facility, and of course it helps whenever you have equipment that is state of the art and constantly learning, constantly new things, and great people in our area.
It's hard to believe that it's been almost. I think John Yanes is working on his second year, and since he's been here, he wanted this to be a place that physicians wanted to work.
Right.
He wanted a place where he wanted you to be happy working here,
Right.
and he wanted the customers to be satisfied. So you get excellent, quick service, and really, I like to put a phrase up that hadn't been said before. It's where love replaces fear. You don't have to be afraid to be in imaging anymore. This isn't going to be like a real loud machine, the old-timey machine.
Right.
And it did scare, because y'all do a lot of pediatric.
We do some pediatric work as well.
And
yes,
I was terrified to a child that bang, bang.
Yes. We try to be very reassuring and extra loving with our pediatric patients.
Well, if you're watching this show, we want to thank you for giving us your time, number one, and we want to invite you to Andalusia Health. You can be referred through a physician. You can come to the walk-in clinic. You go to the emergency room. If you have a need, they're going to get you in, and I'm pretty sure you're going to be satisfied with the service the cleanliness and the happiness of the employees here, it's just a different atmosphere.
Yes.
It's a wonderful atmosphere to work. And it's a great place to stay local and get great service. What a winning combination. Thank y'all for watching. Welcome back, and thanks for joining us at Andalusia Health. This is a business that's been in business for 1/2 of a century. And about a couple of years ago, this new guy came to town, Mr. John Yangs, is CEO, plus they joined Life Point Health, which is a great thing for Covington County and our community. We've always wanted to be a regional hospital, but who would have ever thought 2 years ago that we would have nuclear imaging?
That's right.
I mean, we got a wonderful cardiologist, got approved down at the ER for being a cardiac certification.
Right.
Boom, you don't have to go anywhere else.
That's right.
And believe me, if it's your first time with any type of heart situation, this is a comfortable place to be because it's home.
Right.
And all this is brand new.
It is. This machine is a little less than 2 years old. We started doing the cardiac nuke med studies in January of 2015. So we're not quite 2 years old with the machine. We had to get it installed and all. But this was purchased with the bringing on board of Dr. Price, the cardiologist,
Right.
so we could start doing the nuclear cardiac stress testing.
And Dr. Price is just one of these most wonderful people you'll ever meet. If you meet him in the ER for the first time, he's probably going to save your life. I mean, literally, one way or the other, even if you don't. He's going to be the kind of guy that gives you the confidence to get on with your life and to know that you're going to get the proper medical care
Right.
here at Andalusia Health.
Right.
Because the whole goal now is health.
Right.
And
That is.
that can start at any age. It doesn't have to be when you're a teenager. Some people have had unhealthy lifestyles that leads them to the ER.
Right.
And then when they get on this machine, it's sort of a wake-up call because it's absolutely perfectly an image of what's the problem.
Right. That's correct.
And sometimes you can't see that image with the ultrasound. You can't see that image with the techniques that were old,
Correct.
But you can find that widowmaker with this. And that's what gets a lot of 50-year-olds. So if you're watching this show and you're out in the county, let me tell you, the imaging department, if you drive into Andalusia Hospital, Andalusia Health, it's on the left side. You don't have to check in at the main desk anymore. You come down to imaging.
Right.
You can pre-register. Your doctor can pre-register. And the image goes right to Dr. Price or
Correct.
whoever your
Yes.
cardiologist is.
Yes. Dr. Price has access to the images as well. And as you said, the patients can do everything back here. They register, they have their test. We offer many services. We offer the cardiac nuke med, mammogram, ultrasound, CAT scan, MRI, and also PET scan. So you don't have to go out of town. You don't have to drive an hour to have these services done. We do them right here at Andalusia Health.
And you've extended your hours for female imaging in the mammogram
Yes, for
department. And
mammogram.
that's, so many people work for
Right.
a living. And then you have programs for people that are uninsured. You have programs available. So if you don't have insurance, do not be afraid to get a mammogram. It's very important. And this hospital does about $2 million a year in payments that Medicare doesn't even pay for. So don't let that be a hindrance to you. There are programs out there to help you. And when you have a cardiologist like Dr. Price, first class, he's going to have some help. Y'all, who would have ever thought that he would have that many patients already? I mean, he's booked. How about time waiting to get on this machine?
As far as wait time to be scheduled, we pretty much are going to get you in the next day. Usually within 1 to 2 days for sure. But if there's an emergency, you will be done.
Yeah, you will
we
have people
fit
from the
you in.
ER all the time, don't you?
That's right.
In fact, you also have the nuclear stress test, which you could do without getting on the treadmill, but you do have the treadmill.
We have yes, we do the chemical nuclear stress and then also the treadmill nuclear stress. So for the people that have bad knees, bad backs, you don't have to walk on the treadmill. We can give you the medicine in through an IV to make your heart think that you're exercising.
Well, tell me the truth, Miss Rita. Hadn't the whole culture of this hospital changed? Isn't it a great place to work now?
It is. Our administration is committed to improving patient care. They're committed to their employees, to our continuing education, to making sure we have the best equipment to work with, just to make it an environment that the physicians want to be here, the employees want to be here, and most importantly, the patients want to be here.
And I've been a customer, and I'm 66, and when I turned 65, of course, I got that government Medicare.
Right.
Well, they treat me like I'm a rich person. I mean, really, you get, it's unbelievable the service you get because everybody's treated good here.
Right.
That's the truth.
Right.
Doesn't matter if you're young, old. You even have pediatric patients.
We do.
Unfortunately, you do have pediatric patients in this imaging department.
We do. We take care of pediatric patients, young to old. Doesn't matter.
But you heard it from Rita, and she's in charge out here. And let me tell you, of imaging. You're in charge of imaging. Yeah, nuclear imaging.
Temporarily.
Well,
Donna Broussard and I.
Okay, well, yeah, Donna's pretty good too. Yeah.
Donna's very
she's
good.
very good. But it isn't just the technical end of it, it's the office staff.
Right.
I mean, you can go in there and check in and nothing. And you can also go online and make sure, you know, the day before and fill out all that paperwork online.
That's right.
Very convenient for people that know how to use a smartphone. I mean, it's unbelievable.
Right, yeah.
And for the image to go directly to the cardiologist is just a service that was unheard of a few years ago.
That's right.
So,
And typically we have a report the same day. Reports available the same day for the cardiac imaging.
and for families that are stressed out because their loved one has got a cardiac problem, this is a great stress reliever to get that service within
Right,
24 hours
right.
usually. That's
Right.
amazing. And, so we want to thank you, Ms. Rita, for being on our show today, and we want to thank y'all for considering Andalusia Health, because we always talk about shopping local, but this is the hospital that's going to take care of your needs. They really are. Thank y'all for watching. Welcome back, and thank you so very much for giving us just a little time in your day. We're at Andalusia Health, and we're in the imaging department. Have Miss Elaine here, and she's in charge of the mammograms that go on here in the Andalusia Health facility. Brand new state-of-the-art imaging department you have. If you face the hospital driving in, on the left is the imaging department. And why is that so important?
Because you don't have to check in the front. You can come in that side door and register. Everything's right here.
Isn't that wonderful? And not only that, there's so many single mother head of households in our community, and so many people. I know some mothers that work honestly 3 jobs, and they need that extended time frame in which to get their health taken care of. So you have extended hours. You have extended your hours recently.
Oh yes, yes. Monday through Friday we extend until 7:30 in the evenings. Every other Saturday we do mammograms from 8 to 12. So anyone that cannot take off during the week, we offer the Saturday mammograms as well.
And another big fear that people have is financial. They really do have a financial fear. And what we'd like to express to you, the listeners today, is that in our new Andalusia Health facility, they concentrate on health, a great place for doctors to work, a great place for patient care, and a great place for financial aid. There's so many different kind of financial aids. Don't let finances interrupt your health.
Right. Absolutely.
And you can go to the health department and have an exam.
There's something called the Joy to Life Foundation. There may be an age qualification, I'm not sure, but the health department will do a breast exam, and they also can give you a voucher so that you do not pay for your mammogram. You just bring your voucher with you, and it takes care of that.
Is there a very long waiting period to be able to get this service at Andalusia Health?
Usually if you call, we can get you in that week, within the next couple of days at the most.
And of course, if you go to your regular doctor, physician can certainly
Oh yeah. You have to have the request from the doctor to do the mammogram. They can get it scheduled for you, or you can call and schedule yourself. We do have to have the doctor's order though to be able to get your mammogram. But it's very simple, very quick. It doesn't take but just a few minutes once you're here, to get the test done.
How long does it take to get an answer about your health?
The ordering physician gets the report within 24 to 48 hours at most. It's faxed straight to their office. I also mail a letter to you. Whenever you have it, you should get it within a week to a week and a half at the most. So.
Because you don't want to wait and be anxious at
Exactly.
time.
But if there is a problem though, we call you as soon as possible and get you back in within the next couple of days at the most, so that we can make sure we calm your fears and make sure everything is okay.
So you have a very short waiting time. You have extended hours. You can go to one place to check in instead of two.
Right.
And you can be referred from a physician and that physician will receive
The report.
promptly.
Absolutely.
And oh, I know, October's coming.
Yes, Breast Cancer Awareness Month. So,
Well, October is Breast Cancer Awareness Month, and there's a push nationwide, but especially locally. You really want to see a lot of people in October.
oh yeah, we always have an increase, and everyone is just reminded of how important it is. Everyone has been touched in their life in some way by breast cancer, so it's just a way that we can help you come in and make sure you're taken care of.
Well, we want to invite you or your loved ones to use Andalusia Health. It's an extremely clean facility and extremely efficient. The imaging department in particular is just, the capital improvements are just vast. I mean, this is very expensive equipment, and
Oh yeah.
in every corner of this part of the hospital
Right.
is state-of-the-art equipment. And you have people that are ready to serve you, and they're friendly, and I'm telling you, you will be satisfied as a customer. And Elaine, thank you for visiting with us and letting us into
Thank
your world where you work and taking the time out to talk to us. And like I said, when you get ready for health, think Andalusia Health. Welcome back, and thank you for joining us. Uncle Bob here with Miss Ashley, and we're at Andalusia Health. And Andalusia Health has just got all of the stuff going on. And one thing they have is after you've had surgery, they of course put you in a room and they monitor you 24 hours a day.
Yes.
With some of the most sophisticated monitoring equipment available that you can think of. Tell us a little bit about what you do every day and about the equipment and about, you know, if you have a pediatric case or a surgical case, what you do with them after they're through in surgery.
Okay. When a patient comes up from surgery, we have what we call Visi. It is new. We've had it maybe a year, but it goes on your arm almost like a watch, and we have leads. It's like a heart monitor, and you hook it up and we monitor blood pressure, heart rate, oxygen level, respirations, and your skin temperature, and it's continuously. And all of this is hooked to a monitor at our nurses station. If anything, your blood pressure goes too high, too low, oxygen levels too low, it alarms us so we can go and check on the patient.
How wonderful. So it's, wow, it's like a Fitbit watch, except it really does the job.
Right.
But the nurse still has to come in and check you and wake you up and all that kind of stuff.
Oh yes, we are continuously rounding on our patients. We do hourly rounding. We go in every hour and we make sure that you have ice, water, whatever you need. If you need to go to the restroom, anything like that, we go in every hour.
Well, you know, what we're trying to tell our viewers about Andalusia Health is that it's an absolutely spotless, clean environment, number one. And it's a great place to work.
It is. It is. We have an awesome team of nurses on our floor. We are all ACLS and PAL certified, which is Pediatric Advanced Life Support and Advanced Cardiac Life Support. And everybody's CPR certified as well.
So the certification's there, the technology is here, the friendliness and being able to stay at home with your family is just so, the stress of going out of town is incredible, especially of a small child, and then the parents have to travel, and this way it's you can stay right here and get the same service or better. That's great. And just surgery and pediatrics is what y'all mainly monitor. There are other monitorings up here also, like in intensive care and all, but
right, we have intensive care, but we do surgeries, we do pediatrics, we do the medical and the wounds. We have the congestive heart failure, pneumonia. We do it all.
I do it all, don't you? You see a wide variety of patients.
We do.
And the convenience factor of being in town is that your local physician can get you here, or the emergency room can. Y'all wheel a lot of people up from the emergency room.
We do.
You do. And in the emergency room, they're certified for heart, for just like your certification. The emergency room takes it a step further. But when you get them in your care, it's 24 hours a day.
It is.
Care.
Yes.
And it's excellent care. and we want to encourage everybody to stay at home and use Andalusia Health. Customer satisfaction is going to be guaranteed. They have financial planning for people.
Yes.
They have ways to explain your insurance to you.
Yes.
And 24-hour-a-day monitoring in an absolutely friendly, clean environment. They replace fear with love. Andalusia Health. Welcome back, and thanks for joining us. Uncle Bob here with Miss Angie, and we're down at Andalusia Health, and Angie is the director of services for, wait a minute now, that's not right. You're director of
Senior Director of Inpatient Services.
Inpatient Services. And we're in a brand new part of something that you can do as an inpatient service, and it's very important to our community, is dialysis.
Yes.
And this is a brand new part of Andalusia Health. A lot of capital improvement going on around here. And is this a pretty fun place to work?
It is. I love it. I moved back 3 years ago to Andalusia. I moved to Troy for 20 years. And
Really?
So I started here in January of 2015. And I just really enjoy being able to serve my hometown community.
Well, we'll have to tell you this. I've known Angie since she was a little girl, and she still got the radio flyer we sold her from the hardware store, and because her mama worked at Liv's Beauty Shop. And a lot of people that are viewers out there will remember Liv's Beauty Shop.
On Pear Street.
And then Corinne bought it, and then your mom opened up the beauty shop up in Heath.
Rose Hill.
Rose Hill, Rose Hill. But anyway, this is a local story where a person actually got educated, moved away to Troy, and came back to Andalusia, and it's actually a good place to live. It really is.
It is.
And the hospital has a
Good to be
culture, a work culture that is really conducive to getting positive things done. And that's what we want to tell our customers also. And this is just one example of the whole hospital for in-service patient service.
Right.
And I mean, if a person comes in for another kind of treatment and they're in a room upstairs, you can bring them down here for dialysis.
Right.
Or you can, your doctor referral, I'm sure, to get, if you're a person out there that needs dialysis, you can actually have it done at Andalusia Health right now.
Right. If you're an inpatient.
An inpatient,
Yes.
an inpatient.
Yes. We actually help the outpatient providers when their patients come in. We can dialyze their patients here.
Isn't that wonderful that they don't have to leave the hospital and go somewhere?
That's right.
And not only that, it's just the families, the people that are taking care of people, the caretakers, they have such demand on their lives that this is a relief for the family.
Right. It keeps them from having to travel out of town to go visit their loved ones in another hospital.
That's right.
You know, that's over an hour away.
Well, you know, there have been cases where people that had to have dialysis had to go to the hospital, and they had to go to another location because we did not offer this service.
Right.
And this
Exactly.
is brand new. We're just waiting on our first patient, you know?
Yeah.
So just know that it's here, and know that it's all part of the Andalusia Health Wellness agenda,
Right.
because you're focusing on people's health.
Right.
People can live a long time with dialysis now,
Yes.
and it's not the end of the world,
Yeah.
but it is very demanding when you have to travel out of town.
Yes.
So that's good.
Absolutely.
And not only that, you do other things at the hospital, don't you?
I do. I oversee our ICU, and
Yes, you
I
do.
also oversee our hospitalist program from the clinical aspect of that. I'm their go-to person for the clinical
You've
side.
worked on a lot of health facilities before, haven't you?
I have. I've worked in Troy.
Yeah.
I worked there for 18 years, and then I was a director of nursing in Union Springs. So very small rural hospitals, but you know, it was good to come home.
You can take it from an old hardware man. That intensive care unit is as clean as anything can be.
Yeah.
It's surgical clean.
Yes.
I mean, it's spotless.
Yes.
And you know, there's things that happen during the day that have to be cleaned up, and it's cleaned up and it's spotless.
Yeah. We have a great housekeeping staff here. So
You really do.
We do, and they work as part of our team up there. They come in and they get report just like we give each other report on
That's right.
who's going out, what's coming in, what we need done first. So they are very much a part of our team.
Now the first floor and second floor, but the third floor you kind of reserve for your more critically needy customers.
Well, yes, our ICU. Med-surg will open up soon, I anticipate.
Yeah,
And
yeah.
when winter comes in, we typically open that floor.
Yeah.
We get busy enough that we have to open med-surg on third.
So for all your health needs, you can check with Andalusia Health. It's a company that's been in business 50 years, but it started a brand new chapter.
Right.
And this is brand new. This is a
Yes.
brand new chapter. And it's great to have you home
Yeah.
because it's good when a local person gets an education and comes back and shares those talents with the people in their community. And I want to thank you for doing that, Angie. I mean,
Well, I'm happy to be
your
here.
whole family's just been precious and been part of the community forever. And now you're part of a very vital source of health for our community.
That's right.
So thank y'all for watching, and come see Angie for all your in-service needs at Andalusia Health. Welcome back. Thank y'all so very much for joining us and giving us just a little time in your busy day. I'm over here, Uncle Bob here at Andalusia Health, and I got Miss Melinda Bush, Miss Shelley, and Miss Linda, and we're down in the absolute pristine, beautiful birthing center at Andalusia Health. Tell us a little bit of the history of this beautiful place. And man, it's just fantastic. It's a beautiful room, and one person has a baby in here at a time. You don't have to, and they places for the parents to sit. I mean, golly, this is great.
Absolutely. We have a wonderful birthing center. We have 5 birthing suites. We have 8 postpartum rooms and 3 triage rooms. We try to leave our mothers in their room that they deliver in for the duration of their stay. Sometimes we have to move them up the hall depending on our census. We have comfortable beds, and we have a place for the father to sleep, and we are very family friendly.
Well, Andalusia Health is a 50-year-old business, and they're really concerned about the health and welfare of our community. So do y'all have prenatal classes?
We do have prenatal classes. We offer classes every other month, ranging from care of your baby, nutrition during your pregnancy, labor, the process of it, and pain control during it. We offer it in September, and our classes will be every Tuesday throughout September, and then our next classes will be in November.
Well, that's wonderful, and I'm sure that everybody that works in this part of the building have different certifications. And what are some of the certification requirements for working in the birthing center?
Absolutely. Our crew is most certified, I think, in this facility. We are A1 certified for our fetal monitoring. We have neonatal resuscitation provider certification. We have ACLS, which is advanced cardiac life support. We have BLS, which is our basic life support. And we also attend STABLE, which stands for sugar, temperature, airway, blood pressure, labs, and emotional support. And that gives us a little bit of preparation to help our babies when we have to transfer them to another facility or just to transition them while they're here.
Well, do y'all all 3 like working here?
Absolutely.
It's a great work environment, isn't it?
It
is.
is.
Tell us, Linda, about some of the doctors and nurses that work with you in this department.
We have 2 OBGYNs, Dr. Lee Carney and Dr. Joseph Brown, are our OBGYNs. We have Dr. Baum, who is our pediatrician. We have 16 RNs on staff, 3 LPNs, and 1 unit secretary.
Really?
Yes, we do. We're
And,
very blessed.
Y'all do lactate counseling.
Yes, we do. We have 12 lactation consultants on staff. And you know, we encourage the moms to breastfeed, but we also support their feeding preferences, whether they breast or bottle.
Well, that's very interesting. These labor and delivery rooms, so they're not anything like what you used to see.
No,
I mean, this
no.
is like a hotel room,
It is.
actually.
It is.
And they have, I guess they have their own shower, and they have a place, a rocking chair to rock the baby, and of course you're just a step away from any emergency situation. I mean, right here, you're in the part of the hospital that cares. If you have a neonatal situation, you can go right to work.
Exactly.
Yeah.
We have a OR suite on site, so that we can just go right across the hall if we do have an
You
emergency
don't have to wait
situation.
on an operating room. You
Exactly.
don't have to wait on anything because the registered nurse is here and a doctor, of course. But that's 16 registered nurses. That's a lot of. But you have to be on call a lot of hours too, don't you? People don't have babies at 8 o'clock on Monday morning. Well, they do have other times, right? Isn't that funny? And tell me about, Shelley, tell us about what the golden hour is.
Okay, the golden hour is one of our favorite things here in the birthing center. The first hour after birth is very important for mom and baby. We like to keep them together. We like to keep them skin to skin. This helps the newborn to transition to outside life, the temperature, blood sugar. It just helps the newborn to transition smoothly to being outside the womb. It's also been proven to be most beneficial for breastfeeding success. So.
Okay. It bonds the mother
Yes,
and the
mother
child.
and baby are able to bond.
But
So.
before birth, you have the state-of-the-art fetal monitoring,
Yes.
and tell us about that.
We have Centricity perinatal monitoring system. We can see what's going on with our patient at the desk, in other patients' rooms. We can see the tracing on a central screen. We don't have to sit at the bedside to see what's going on with our fetal monitoring, tracing, or the contractions. We can see it in other rooms or at the desk. So it's really, we don't ever take our eyes off our patients that way. So.
And you know, this is a family hospital, and you feel like family when you work in here,
Yes.
but these are people that are starting a new family,
Yes.
and it's important to have that bond and that quiet time and to be in the same room. So you take care of couples.
It's couplet care is what we do here.
couplet care.
Couplet care. It's what we do here. In the past, babies used to be sent to the nursery often, or as soon as babies were born, we would take them to the nursery for 4 hours, sometimes separating mom and baby. We don't do that anymore. For about the last 3 years, I think, we've been doing couplet care, which is where we try to keep mom and baby together in the delivery room at all times. So we don't take the baby to the nursery for anything unnecessary. We will only take the baby to the nursery for testing or like if the mom requests to get some rest. Otherwise, we keep mom and baby together. It promotes bonding and promotes breastfeeding. So.
Well, thank you, Shelley and Linda and Melinda. And listen, Andalusia Health has been in business a long time, but this is a major capital investment to have this birthing center. And it's something our whole community can certainly be proud of.
Yes.
And you can get service here that you can't really get anywhere else because it's so stressful for families, grandparents, and parents to travel somewhere out of town to see their brand new child or grandchild.
Exactly.
And you got the whole package here. You've got a wonderful doctor suite over here with the obstetrician and gynecology, and then you have Dr. Brandon and what's the other doctor?
Dr. Carney.
Dr. Carney here. He just moved here from Mobile. Wonderful guy. And I mean, these are really people that care. The doctors and the nurses. This is not a joke, y'all. They really care. And this is a hospital that cares about your health. And a birthing center is where it all starts.
That's right.
So they got you covered over here at Andalusia Health. And so if you and in your family have a need for a place to have a child and a wonderful community of people to support your child, I would highly recommend Andalusia Health. Thank you, Miss Melinda,
Thank
Miss
you, Mr.
Shelley,
Bowden.
Miss
We
Linda.
appreciate it.
Thank y'all for joining us today. Welcome back, and thank you so very much for joining us, giving us a little time of your day. I'm down here at Andalusia Health, and this is one of the best kept secrets in the world. This is a great place to have a surgical procedure done. We're going to talk about surgical services here with Miss Donna Grissa and Miss Terry Frazier. Let me tell you something, this place is clean, and it's got all the modern equipment. And, well, we're just going to let you tell about the brand new machine that looks down your throat and down the other end too.
Down the other end,
That's
yes.
right.
Actually, we're standing in front of part of the new equipment that we made a significant investment in patient safety and patient care this year. This is our endoscopic equipment. We do EGDs and colonoscopies with this. It's high definition, which means that it can see the tiniest of polyps. And if you don't get the tiny polyps out, they can and will turn into a cancer. So we need to take that Bob. We need to have that colonoscopy.
I'm a perfect example. Don't do what Bob did. Do the opposite. I'm 66 years old and I've never had the privilege of having this service done. And you really need to have it done before you're 50.
Yes.
I mean, there's really no excuse
Right.
in a modern world for a person not to find it out because colon cancer, when it strikes, it's real.
And it can be prevented. At 50, you need to have a screening colon. And
Most insurance pays for
Yes.
that.
Oh, absolutely.
so I'm gonna get you on the schedule.
It's not, you know,
Next week.
the thing about it is, when you go into a hospital, you're not going to catch anything. Everybody thinks that if you come here, you're going to catch colon cancer.
No.
You're not going to catch colon
No.
cancer from getting the
No.
thing done.
No.
And you go prevent it.
Exactly.
Exactly.
And it's a very easy test.
And it's
Very
also,
good.
speaking of easy, Miss Frazier, tell us honestly, seriously, how easy it is to get the procedure.
Done.
Yeah.
Yeah. You know, we have a pre-admission department, and they come in, and you get scheduled for a pre-admission appointment. You come in, you give the nurse your history. If it's something as simple as a colonoscopy, they sometimes can just do that over the phone. You know,
Right.
you don't even have to come in. If it's just a simple screening colonoscopy, they can call you on the phone, get a brief history from you, and then if there's any red flags, and they'll go from there. But then for big procedure like a total knee replacement, you come in, the nurse gets your history, you see anesthesia, you get your lab work done, an EKG, and then if anything pops up, then they do further testing from there. But then it's usually pretty quick in and out. A total knee, probably you're in and out within about an hour.
Tell them about your beautiful recycled outpatient surgery wing. I was
Oh,
truly impressed with that. I mean,
yeah.
used to when you went to outpatient surgery, you put in a cubicle.
Yeah.
Now you got a
Yeah,
suite.
we
You got
have
suites.
We have 12 rooms that are big rooms. It used to be our inpatient rehab, and then we took that over about 3 or 4 years ago, and it's really nice. It's very contained, so you can go from there to surgery and home without ever having to be out in the main lobby of the hospital. So there's
They'll
women
let
with
you
their
go right
hairs
out the
on.
back door when they
Yeah,
go to you.
that's right.
Yeah.
And
That's
it's,
right.
I mean,
Yeah.
you pull your car right up, and you're
Yeah.
home in 2 hours. It's
Right.
amazing.
Yeah, and the
Yeah.
women that worry about the hair being messed up, they don't have to be out in the public for people to see them. They can
Well, and just
sneak out the back door, and
Exactly.
and
Exactly.
it's very convenient. Then we have a big room that we do we're doing cataract surgeries today.
yeah, today's cataract.
Uh-huh.
clinic.
Yes, it is.
So we have
That's
a
why
big
it's so
room.
busy.
That's right. So we have lots of services here.
Well, your
For a small
health,
hospital.
your health is a privacy issue, and back in the old days, people did see you come and go to outpatient surgery. But now, they bring you in, wheel you into surgery, and literally take you back to a suite, come in and check you, and then if you're okay, they send you home.
That's right.
You
Yeah.
can't beat that deal,
No.
and you don't even have to go out of town
Oh,
Nope.
no.
at all.
Most time you're home in time to go to McDonald's.
Well, we've got I introduced, well, I didn't get to go to McDonald's, but anyway, I did a couple of interviews with Dr. Kelly. And Dr. Kelly is our new orthopedic surgeon here. And of course, you see a lot of knees being scoped, but he also does carpal tunnel. And they used to not be able to scope it.
Right.
I mean, that's new, isn't
Right,
it?
that is new.
And
And very quick,
not invasive.
not
Right.
invasive, yeah.
And,
It's a single site.
Yeah.
And you just have one puncture wound right here rather than the big incision that went from your wrist to the palm. So the recovery and the postoperative pain is much less intense than the bigger incision was.
And if you're watching this show and you have a loved one that's been a farmer or a mechanic or somebody that used power tools a lot, chances are they may have a little carpal tunnel syndrome there. And the beauty of it is it can be done as an outpatient
That's right.
surgery
Yes.
That's right.
and with a scope.
Yes,
How wonderful.
yes.
And also, Dr. Kelly has come up with a new product that y'all can be introducing. It's a forever knee, basically.
Yes.
I mean, when you're 66, you're afraid to be put to sleep, you're afraid to go to the hospital, you're afraid to even pull out your insurance card because you had never done it before. That's the truth. But when you come down with your health, you have advocates here. You have people that are financial advocates, you have people that are advocates for your safety and health while you're here, your privacy. And they're advocates for getting you to the right person at the right time, whether you come in the walk-in clinic or the ER or referred by a physician.
Yes.
You're going to get great health care here because the key word there is health.
Right.
Okay? So anyway, you don't want to be put to sleep when you're 66, and you don't want to do it 10 times. You don't want to have 2 different knee surgeries.
right.
Well, now they've got a brand new product that takes, as I understand it, less bone away. And,
It does.
And it lasts a long time.
It does. It's actually the Conformis knee, which is the brand that he chooses to use, and it's bone sparing as far as the implants are made specifically for your knee. We take an x-ray, well actually a CT of your knee, and then they build the implants to match your knee. Whereas the other type of knee implant, they cut the bone to match the implant.
Right.
So this way, we don't have to cut as much bone. And the bone is what actually makes it more painful postoperatively.
Which goes to show you that the capital improvements made in Andalusia Health started in the imaging department, and the CT scan and the cardiac scans, the nuclear
Yes.
scans they have, it pinpoints stuff to the as close as humanly possible to do. And when it measures your knee, and then they go out and build a knee for you, my goodness, you can't get any better than that.
Yeah.
And so it's a total package out here in Andalusia Health. The world's changed. It's more than it used to be. It's a great place to work. It's a great environment to
Fantastic
work.
place to work, yes,
Yeah, we've
it
been
is.
here a long time.
Yes.
Yeah, you
But
have-
between us, but
Yeah, I've
what?
been here 20 years.
Really?
I've been here 18.
Really?
Yes.
Wow. Well, you know, hang there a couple more years, maybe you get to put both my knees in. You know?
We'll do it. We'll do
Hey,
it.
I like that idea. I like to know who's operating.
That's right.
That's
Yeah, I have
right.
a lot of patients that say, you know, it's so much better than going out of town because we know who's taking care of us and we're not just a number.
Right.
You know, you go to some bigger places and you're just patient numbers, blank, 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 blank.
No.
And here, oh, hey, how you doing? I saw you in church Sunday. You know, of course, if you're coming for a colonoscopy, they're not so, you know.
Yeah.
But, you know,
It's
for
important.
most things, you know, they're glad to see faces that they recognize.
Well, with the extended hours over for mammograms, and of course, you have somebody that will do these procedures daily. I mean, you know, just have one day a week you do it.
Right.
You have more than one doctor.
Right.
Oh, yes.
And you, it's, for as many procedures as done here, it's extremely, I mean, this building has seen a lot of action and it still looks new.
We actually performed over 3,500 surgical procedures last year.
Wow, that's
So-
amazing. That is amazing.
And we're expected to increase that, I would almost say by double this year.
Really? So here we are at Andalusia Health, a 50-year-old business that's reinvented itself in the last couple of years with huge capital expenditures for brand new equipment. Got the best, y'all have recruited some of the absolute best doctors and nurses. How many nurses are working down here in surgical? We had about 19, 16 over in birthing center.
We have around 11 right now with an outpatient and recovery and back in the OR.
One day we're going to do an interview just the economic effect that this hospital has as an industry
Yes,
for this community.
yes.
Yes.
But it's rare to have such a wonderful place that really cares about your health, cares about the doctors and the employees, so that everybody together works to improve the health of our community.
Right.
Yes.
And we're grateful for that. And we're grateful for y'all watching. Thank y'all so much. And if you need some help, check out Andalusia Health.